Is bariatric surgery an option for curing diabetes?
You know, bariatric surgery get a lot of traction in the recent months, or I would say for the last 2 years, and it has very good press. And in reality, what we had seen is that some people, especially if they have diabetes in a very early stage, and they are significantly overweight or obese, when they lose weight by bariatric surgery, especially gastric bypass surgery, they may get partial or complete remission. But this is not it doesn't mean cure. It's not cure. And even that remission is a temporary remission because there is no change in the lifestyle. People gain the weight back, and if they get the weight back, they will get the diabetes back even if they have remission. The second is that people have to consider that this is still a surgery, and it has a lot of consequences, short-term and long-term, especially nutritional deficiencies. People end up with a lot of nutrition deficiency, protein malnutrition, osteoporosis, folic acid deficiency, vitamin B12 deficiency, iron deficiency. So, and they will live with these deficiencies for the rest of their life, and they have to take supplement all the time.
What's the long-term success of bariatric surgery?
Again, this is debated. Most of the clinical trials that had been published are for very short duration. They are 2 years, maximum 3 years. The only study that has very long duration was done in Sweden, but it is mostly about surgery that is not commonly used these days. So this data cannot reflect what is the impact of other types of surgery.
So the truth is, it's not a silver bullet.
I personally, I think it should be the last option. It is not the first. In WhyWAITTM program, for example, we have people maintained weight loss for 5 years. More than 50% maintained around 10% weight loss for 5 years, and this without surgery. And the most important that you change your behavior. When you do the surgery, you are not changing anything.
Right.
And then any reason that makes that person initially gain the weight may still exist and cause weight regain again.